Casey, g'day. So those Victoria numbers have just come through in the last hour or so. What's your reading of what's going on there?
Yeah, hi Joe. Well, it's lower than yesterday, so that's a good thing. And kind of all of the measures of the breakdowns, you know, how many cases are under investigation, how many cases have been out in the community while infectious, they're both down a bit as well. But as I have said many times before, and I will continue to keep saying, one day does not a trend make. And we really we're still, even though the numbers feel, you know, they have been growing and they're kind of scary looking in Victoria as to where this could go from here, they're relatively small in the grand scheme of things in that one cluster here and there, you know, rapid growth in one particular outbreak can really have a big effect on these sorts of things. We're still kind of on that, walking that tightrope in Victoria where one big super spreading event can make a massive difference. And we've also got a fair few cases that were out in the community while infectious today, out of today's numbers, out of yesterday's numbers particularly, where you know, we wouldn't have seen the full effect of those cases being in the community while infectious. So we'll welcome a smaller day. We want to see more of them. Today, those 50, 39 of them not isolated through their infectious period. So we're still in that point where most of the cases, the vast majority of cases, have some exposure in the community. We need that number to come back down to zero.
Yeah, so what's the likelihood that Victoria is going to get back down, be able to get back down to zero before we get to 70, 80% vaccination coverage?
Oh, that's the million-dollar question, isn't it? Before we get to 70, 80% vaccination coverage, you know, that is a threshold that I would hope we will start to see a bending in the curve under lockdowns in all settings, because that's what the Doherty model that, you know, predicates this whole model, this whole transition plan is sort of based on. You know, the Doherty modelling suggests if you can get to 50 or 60% double dosed across the 16 plus community, plus a lockdown, plus all of the other public health measures that we've got, plus not even fully effective test, trace and isolate, all of those things together should start to see a bending in the curve. I think the question, that's an experiment. That is the first test of the Doherty modelling we'll definitely be seeing play out in New South Wales. And the question for Victoria is, can they bring their numbers back down to zero before we need to see if that modelling holds up. And of course, if the modelling doesn't hold up, well, that is what the phase B and C triggers are all kind of based on. So we'll really need to have a rethink about what those triggers look like. So the first test of the Doherty model, Doherty Institute model, if you like, comes well before 70 or 80%. We need to see a bending in the curve before then.
Yeah. Okay, now turning to New South Wales, how's the Western Sydney vaccination blitz going? Because Western Sydney, day after day, continues to account for a huge proportion of those numbers. I think yesterday it was up around 70% of the 800 odd.
Yeah, overwhelming percentage of the cases still in that Western Sydney, and a part of Western Sydney that's growing, we should say, and a fair few local government areas affected. Let me just show you the cases quickly. Cumberland, 140 cases a day on average. That's kind of seeing the biggest, steepest curve at the moment. Canterbury, Bankstown, 117, 93 in Blacktown. This is the 7-day average, and the curve we know has been growing. So some really big numbers there. These are the places that you'll have the most bang for your buck from doing vaccinations in terms of actually trying to bend the curve. And what we're seeing is really good, is in the last 3 weeks, some really massive numbers of vaccinations happening in this part of Sydney in particular. Blacktown, not the LGA, but a larger kind of Blacktown region had, sorry, not Blacktown, Southwest Sydney, the kind of Southwest Sydney region had, I think it was the it was the 8th lowest vaccination rate in the country, first dose vaccination rate in the country 3 weeks ago. Now it is above average because we're seeing some really, really big numbers. In the Blacktown region, 64.8% of people now have a first dose. That's up 11% in the last week. This is the fastest vaccinating part of Australia right now. And second fastest is Parramatta. 10.4% of people got their first dose in the past week. So we're up to 58.1% of the 15 plus population there. In Southwest Sydney, 56.3% of the 15 plus population there. So all of these areas are now above the national and the New South Wales average for vaccination rates. They're the kinds of numbers we want to see. If the vaccination rates are going to bend the curve sooner rather than later, well, this is where you want the highest vaccination rate in the country. And thankfully, that's kind of what we're seeing now. We're on track to see these parts of Sydney hit 70%, hit 80%, earlier than anywhere else in the country. So that's great news.
Yeah, and Casey, you're keeping a close eye on those vaccination rates across Australia. Just with the situation developing in Victoria at the moment, hopefully they'll be able to get on top of it. But does Victoria have a similar rate to New South Wales at the moment?
So Victoria, let me just take you through a couple of things. Question without notice, thanks Joe. We've seen an increase in the number of vaccinations being done in Victoria, 62,000 at the moment. The pace in Victoria is still significantly slower than New South Wales, but it's picking up. We're seeing across, let's take you to, not that one, let's take you to the state-by-state numbers. We've seen 51% now of people in Victoria, 16 plus have a first dose,
Right.
30% have both doses. When you look at the regional breakdown, a little concern I have is that we're still seeing below average vaccination rates in the west and the northwest of Melbourne, and they have proven multiple times now to be areas where ingrained transmission is more likely, and it's harder to eliminate the transmission that you see there. So really, it's good that the Victorian government has set some sort of clear targets for really upping the vaccination numbers, because on the current pace, they're a fair way behind kind of the speed of New South Wales, particularly in those areas where, you know, you would like to see vaccinations affect transmission, reduce transmission in the shorter term rather than the kind of medium-long term. When are we opening up as a nation? You know, how can this actually help reduce illness and sickness and death now?
Yeah, and stunning to hear in that Victoria Media Conference yesterday, 10,000 people not turning up for their appointments. Okay, we'll leave it there. Casey Briggs.